Hello, my name is Daniel Corbin. I'm in BSN 246, and today I'll be doing the head-to-toe assessment skill video. To begin my video, I'll enter the patient's room, closing the door behind me for patient privacy, introduce myself to the patient. Hello ma'am, my name is Daniel. I'll be your nurse today. Can I get your first, your last name, and date of birth, please?
Kathleen Monteiro, January 18, 1993.
I'll check the wristband and make sure I do the correct patient. Great. Ms. Montero, I'm going to be doing a head-to-toe assessment on you. Is that okay? Okay. I'm going to perform hand hygiene. So on a clean pair of gloves. At this point, I'll be checking the general survey of my patient, making sure she's not in any distress, checking her breathing, also her clothes. The clothes seem to be in order, clean. She doesn't seem to be in any stress. Breathing seems to be okay. Sir, are you in any pain at all? Pain? Okay, I'll document that. Also, I'm going to be checking your vital signs, okay? I'm going to be checking her blood pressure, her SpO2, her heart rate, temperature, and respiratory rate. Once I have those all documented, I can start my assessment. For that to do, I'll start her head. I'm going to be checking her hair, looking for any missing or broken hair. Also looking for any lesions or crepiness, just kind of palpating, any tenderness. No? Okay. Move down to her ears, checking behind her ears, making sure there's no lesions or redness. Let's put there, this side. Let's put there, okay. Check inside. I'll be checking inside her ear for any discharge, the tympanic membrane, making sure there's no redness or abrasions inside the ear. Everything looks good. Side here. Okay. Okay, I'm going to perform a whisper test on you, okay? I'm going to whisper a number behind your head. I want you to tell me what that number is, okay?
7. 60.
Perfect. Okay, at this point, if I have the tuning fork, I'll be using a tuning fork to check her hearing. So I'll be ringing on each side, and she'll be letting me know where her hearing on each side. Okay, now I'm going to be moving to your eyes. Okay, I'm checking your eyes for symmetry. I'm going to be looking down on conjunctive here, making sure conjunctive is pink and her sclera is white. Look at me. Okay? Okay, I'm going to be shining a light in your eyes, okay? Just look straight ahead. Okay? Alright, eyes are permanent. I'm going to be performing a vision test on you, okay? I'll grab this chart here. I'll be going 10 feet away, having her close one eye, read the line that she can, close the other eye, do the same thing. I'll document that. Okay, I'm moving to her nose. I'm kind of palpating her nose, making sure there's no tenderness, crepiness around her nose, making sure her nose is symmetrical. No pain?
No.
Alright, go and look up for me. I'm checking her nares, also her septum, making sure it's straight and no issues inside her nose, no discharge. Everything looks good. Go ahead and block one nair for me. Breathe in and out. And the other. Okay, nares seem to be patent. I'm going to move down to her mouth, checking her lips, make sure her lips are pink and moist. Everything's looking good there. I'm going to have you open your mouth. I'm going to be checking her tongue, her teeth, her gums, checking her uvula. Go ahead and say ah.
Ah.
Her tonsils. Great, everything's looking good there. Alright, I'm going to be kind of palpating her sinuses. Okay, check for any swelling or tenderness. Again, checking for tenderness or swelling behind your ears, for lymph nodes. No pain?
No.
Good. So now we're doing range of motion. I'm going to have you turn your head from side to side. Go ahead. Good. No pain?
No.
Okay, I want you to turn your head one way, and then I'm going to put my hand here. I want you to fight back against it. Okay, ready to go. Good. The other side. And back. Good. Eagle strength on both sides. I'm going to be putting my hands on your shoulders. I want you to shrug your shoulders up when I'm pressing down on you, okay? Go ahead. Good. Seems to have equal strength on both sides. Okay, so now I'm going to be moving down to her neck. I'm going to be checking her trachea, also for any jugular distension, any tenderness or abrasions, any tenderness,
No.
any pain.
No.
No, everything's good there. Okay. So now I'm going to be checking your lung sounds. When I tell you to, just take a deep breath in. We listen to 6 spots on your front and then 6 spots on your back. Just listen for when I say take a deep breath and do so for me, okay? All right. Take a deep breath. And again. Again. Deep breath. Deep breath. Okay, moving forward for me. Okay, deep breath. And again. Again. Okay. One more time. All lung sounds are clear. Have you had any problems coughing lately?
No.
No trouble breathing? No? Okay, I'm going to palpate your thorax. No pain or tenderness there?
No.
Okay. So I'm going to be listening to your heart sounds now. You can breathe normal. Breathe normal for me. Sounds are audible and even rhythm. Okay, I'm going to check your arms. Checking your radial pulse. Again, checking your arms for any lesions or abrasions, scarring. Change your pulse here. Okay. Okay, check your capillary refill. 1 second, perfect. 1 second, perfect. And we'll be checking your carotid pulse. And one on the other side. Let's check your temporal pulses. Okay. Alright, so now we're going to move down to your abdomen. I'm going to inspect your abdomen. I'm going to listen to your abdomen, your bowel sounds, and then I'm going to palpate your bowel sounds, okay? Okay, inspecting, I'm just looking for any abnormalities, any issues, obviously discoloration or lesions. Okay. This is sounds here, just breathe normal for me. And I'm checking for any tenderness, masses, any pain there?
No.
Good. Have you been having normal bowel movements lately?
Yes.
When was your last bowel movement?
Just morning.
Great. Okay, so now we can move to reflexes. I want you to kick your leg out for me. Okay, any other? Now, can you kick your leg out and rotate your ankle for me? Okay, any pain in your joints? No? How about this one? No? Okay, I'm going to be checking your fetal pulse on your feet here. Okay, and this one. Good. I'm going to be checking your dull and your sharp sensation. I'll be pressing a pen. I want you to tell me if it's sharp or dull, okay? How does that feel?
Dull.
Dull? And the foot here. How does that feel?
Sharp.
Okay. Good. Dull sensations are within normal range. Okay, so now I'm going to have you stand up, and I'm going to check your gait and your coordinations. Go ahead and stand up for me. Any pain in your joints when you stand up? Any issues standing? Any falls lately?
No.
Okay, go ahead and walk back and forth for me. Okay, checking gait, making sure she walks right. There's no issues in her back. Perfect. Go ahead and have a seat for me. Alright, now I'm going to be checking your orientation. I'm going to be asking you some very simple questions, okay? Can you give me your name?
Kathleen.
Your full name?
Monteiro.
Okay, and what date's the day?
July 20.
And where are we right now?
In my house.
And who's the president?
Trump.
Okay, so she answered all the questions correctly. I'll give her an A&O times 4. Also Glasgow score. That is her eye-opening verbal and motor skills. She has answered all my questions. She opens her eyes. She's performed all actions, so I'll give her a 15 Glasgow score. I will be checking her skin for any lesions, any abnormalities, scarring issues. Do you have any questions for me?
No.
No. Okay, I'll remove my hands, my gloves, perform hand hygiene. I'll provide the appropriate education for my patient. So is there anything else I can do for you?
No.
I'll go document my findings.